guys, so I hope you guys like this video. It's just gonna be very short. I'm just gonna go through and show you guys what is in the room. These are micro brushes. This is etch. Anytime you're about to do any type of filling or buildup, you're always gonna grab etch. This right here is just dapping wells, dapping dish, whatever you want to call them. They're used to hold Desensitizer, which is right here, or any other thing that you're going to use, like especially for Bond. Bond is the main thing that you guys are going to see universally. Bond is everywhere, but you're going to see it in different types of brands. And that's what you will notice about a lot of these things. It's the same stuff, but it's different brands. So this is the Bond, of course. And then this is the Desensitizer. You can use it anytime you're about to do a filling to relieve sensitivity prior to. This right here is Snoop. Some doctors use this just to make sure that they've cleaned up all the cavities, make sure there's no more decay left inside of the tooth. This right here is Flowable. You will see so many different brands of Flowable and in so many shades. They come in different shades just as Composite would. This is another version of Flow. As you can see, SDR Flow. So it just depends on your doctor's preference. This right here is Limelight. Limelight is used something like decal. If you guys are familiar with that, you'll just put it as a liner over the tooth when you feel like you're reaching too close to the nerve so you don't hit nerve exposure. This is Traxident. Traxident is used to kind of replace cord. So you'll place it on the tooth and you'll have the patient bite down on these little caps right here. They come in 3 different sizes and you'll just wait for a little bit, then you'll rinse it off and then it acts as retraction. This right here are just extra wells. You can pretty much use them for whatever you want. These one right here is called Quick Stack. Quick Stack is anytime you're getting a patient who's starting to get some bleeding in the area that you're working in, you're always going to have that ready, and make sure you have your high speed suction ready as well as bite paper. This is articulating paper that's in the horseshoe. This one's used for dentures and partials. These right here are all the different tips that go with all the little different types of tubes of material that I just went over with you guys. This is a composite gun, and these are all the different shades of composite that you're going to use. We have A1, we have A3.5, we have B1, and we have A2 and A3. So these all go depending on the patient's tooth shade. These are just extra tips over here. Oh, I'll get into that in a minute. This is Traxident. That's the tips that go with it. And this right here is just a box full of wedges, matrix bands, all types of different bands, you guys. We have like the little clear strips. This is all for filling. So anytime you're placing fillings or buildups that are 3 surface fillings or buildups, which a buildup is always going to be 3 surface, but 3 surface fillings, you're always going to use those. The clear strips are used for anteriors. So this over here, this is just temporary cement. You're going to use it anytime you are making a temporary. You're always going to use temporary cement. This right here is just a permanent cement, but this one is for anteriors. This one is a buildup material. This comes in the clear shade. So basically tooth colored, as you guys can kind of see on their Flow Core. The next one is just another type of cement. This one is for anteriors as well. This one right here is a temporary filling material. It works like IRM, but it's able to just be squeezed out in a tube when you're doing root canals and you don't finish. This right here is another type of buildup material, but this one is actually in the shade blue. So as you guys can see, it has a little blue line on it. It comes out blue. This one right here is just another type of permanent cement. Not quite sure what it's for. I think it's implant cement. We don't use it that often. This one is another temporary cement, but it is clear. It's best used for anterior teeth. This one is the most universal permanent cement you're going to see. This is Reliax. It's used everywhere, and it comes in different types of tubes. This right here is Liquid Dam. We mainly use it for when we do whitenings, but a lot of dentists will use it to block off the tooth when they are doing a root canal. That way we don't get any micro leakage into the actual root canal. This right here is Silane. We use it to do veneers when we're cementing on the final veneer. This right here is to place buttons when you're placing Invisalign. Tetric EvoFlow. So that's the one that we use because it's easy to get often, like if you use Flowable. This is IvoClean. Anytime that you are cleaning out a crown to place it for the first time, a permanent crown, you're going to clean it out with IvoClean. So that's that bin there. And then this is just Teflon tape. Anytime you are doing anything with implants, you make sure you have your Teflon tape ready and pieces of it cut off, ready to go. This right here is just, what is this stuff called? Surgical tape. We just use it for anything. So you just always make sure you have some surgical tape. It's used for almost everything. This right here are just kind of like what I showed you guys with Traxident. This Traxident would be what would replace this. So this is cord. Some doctors will use cord. Most of them nowadays, they don't really use cord. But if they do, it always comes in 3 different sizes. Double O. Then you have just O. And then I think you have 1, 2, and 3. But it all depends on what your office orders and who's using it. This right here is just a mixing pad to mix up different types of materials. And this is the tips that go to all of these. It's universal, so they're gonna go with all of them. To the second drawer we go. So this one, it just has pretty much everything you use all the time. These are single floss. These are just regular flosses as well. These flosses you actually just pop open, you rip them open, and it's just one piece of floss. These are cotton tips or Q-tips. You use them for anytime you're placing topical. This is the topical, you guys. And these are air and water syringes. Make sure you always have 2 of them, one for your side, one for Dot. These are long syringes for the lower teeth. Always, these are top syringes. The short ones, they're always for the top teeth. These are just cotton rolls. These are pieces of gauze or 2x2s. These are Septocaine. These are Lidocaine. This is like, I think, a stronger one. I think this is like Xylocaine or something like that, if I'm not mistaken. Yep, Xylocaine. And then the one in the back is a Carbocaine. Carbocaine is used, or either Mepivacaine. They're used when a patient has allergic reaction to epinephrine or their heart races. So you will use that. These are triangles. So the triangles, you'll take them and you'll slip them on the patient's cheek side to whatever side you're working on, and it'll just help the doctor keep that area dry. Hence, triangle. These ones are high volume suctions. These are the saliva ejectors, and these are surgical suctions, which we need to restock those. So this is the next drawer. These are just our intraoral camera sleeves. So anytime you're taking an intraoral picture, you would always use these sleeves to cover it. And this is an intraoral camera and how it fits on. These sleeves next to it are the ones that are for our x-rays. And then we also use those to cover our curing lights, just as an extra barrier of protection. In this little cup up here, we just have markers. We usually have pens, but we're ghetto and we don't have no pens. And then this is just our headrest cover drawer. This is just our tray papers, and then our bibs for the patients. These are just prelims, pre-ops, prelim impressions, pre-impressions, whatever you guys want to call it. Is what you take prior to starting a crown. That way the patient always has a backup. This is just peroxide, gloves, tissue. We have a mirror, we have glasses, and we have a Cavitron. Over here is our computer and our trash. And then this is our Cavicide spray, a sink, and then we also have our Cavi wipes. This is alcohol to wipe instruments when you're doing any types of procedures to keep them clean during the process. This is just our root canal cart. This is just sterile water. Just always want to make sure you have that. And these are gloves and masks, and we have gloves in all different sizes because everybody has different size hands. And then that's the office. I hope you guys like this video. Please comment, rate, and subscribe.